7 foods that diabetics avoid, but are actually excellent for your health and even help control blood sugar levels. In this video, I'm going to tell you about 7 categories, giving several examples and explaining why these foods are good for you. And you'll also understand why so many people consider them villains. If you're trying to control your blood sugar levels, information's essential. So let's get started. What are these 7 foods? The number one food that many diabetics avoid, thinking it will raise their blood sugar levels, is actually a whole group: fruits. If you are diabetic, if you are watching your blood sugar levels, not only can you eat fruit, you actually should eat fruit. Fruits are allies in diabetes management. Cutting out fruit, avoiding it, stopping consumption, or even just reducing how much you eat is a serious mistake that can actually make not only your diabetes worse, but also your overall health. And what are the best fruits? Avocado and berries are also great choices. Guava, strawberry, blueberry, raspberry, cherry, citrus fruits, passion fruit, lemon, and even pineapple. A lot of people say that these have too much fructose. While we're on the topic, doesn't fructose harm diabetics? And the answer is no, fructose will not harm you. What causes harm is an excess of fructose. If you eat 15 or 20 bananas, of course that's going to harm you, right? Now, oranges with pulp, excellent. Another fruit that's also really good, nectarine, peach. Diabetics are not only allowed to eat these fruits, they actually should include them in their diet. Now, some fruits, like bananas, as I mentioned, and even grapes, fruits that have a higher glycemic index, glycemic load, or a greater amount of carbohydrates, those, yes, you need to keep an eye on, okay? But nobody becomes diabetic or makes their diabetes worse because they're eating too much guava, for example. Have you ever seen that happen? No, so fruits are allowed, and you not only can, but should eat them. A healthy diet, you can include 3 or more fruits a day. That's not what's going to cause you to have excess sugar. What can actually cause excess sugar are sugary drinks or fruit juices. For example, when you make juice, if you eat an orange, you're eating the orange along with the pulp. But when you make juice, you combine several oranges in one glass and remove the fiber. In other words, for people with diabetes, that's not a good combination, okay? Because you have a lot of concentrated sugar, and that sugar will really raise your blood sugar levels. I'm talking specifically about people with diabetes here. If you don't have any issues with insulin resistance or high blood sugar levels, orange juice won't harm you either, okay? That's why you see a lot of videos saying, oh, orange juice is fine, you can drink it every day. And the answer is yes. But if you have diabetes, then you need to pay attention to this, okay? With juices, apple juice, mango juice, even pineapple juice, and even strawberry juice. Some versions are concentrated. Even strawberries, which are an excellent fruit for diabetics, the juice should be avoided. Grape juice too, it's very concentrated, but the fruits themselves are excellent. Don't avoid the fruits. The second food that you're probably avoiding, and this one is pretty controversial, so pay close attention to what I'm about to say, are potatoes, bread, and rice. But aren't these foods forbidden? The answer is no. You can eat potatoes if you're diabetic. So what's the issue here? If you have high levels of sugar in your blood and those levels are really elevated, you're in a very uncontrolled phase. Your body is handling carbohydrates very poorly and can't process them. Then, at that stage, when your levels are really high, it's wise to avoid potatoes and those kinds of carbohydrates, but only during that phase, okay? Not all of them, but you should moderate your intake. Now, for diabetics who are well controlled, or for people who don't have diabetes but are concerned, maybe they're in that pre-diabetes stage, a healthy diet can include rice, for example, or bread. What's a tip here to reduce the impact of blood sugar levels? For example, And if you add a source of protein like eggs, cheese, or even chicken breast to your bread, you can make it part of a healthy meal. All right, so you don't have to cut it out completely, just have some moderation. And if your levels are really high, then yes, it's worth it. Holding back on those carbs is important, but it's not the carbs from potatoes that are going to make things worse. It's really, for example, the carbs with added sugar. If I drink a sugary beverage or eat processed foods, or if I eat a lot of potatoes or french fries, for example, then yes, that can make things worse. Now, a balanced meal with a bit of salad, rice, or grains, or lentils, beans, a portion of protein, some meat, that's not what's going to make everything worse. That's what I want you to understand here, too, so you can stop being so afraid. A third. So, why are those videos that make you afraid of food not right? You guys ask about this all the time, right? I like to answer questions now during the videos because these kinds of videos tend to go viral. Just imagine there's a doctor out there banning bread, banning potatoes. A lot of people end up sharing it, and then the video gets a lot of attention. But that's not the approach I take here on the channel, okay? I don't like to scare people, so yes, you can eat those things. You can have a little bit of potato. You can eat bread if you like bread. You can eat rice too. That's totally fine and always has been. Ideally, try to add fiber and other sources of protein and fats as well to balance out your diet. Now, if you wake up in the morning, for example, or at breakfast time, as our Portuguese friends call it, pequeno almoço, and you eat bread, then add jelly, then more butter, then cream, then dulce de leche, you just keep adding things, right? In that case, yes, it's better to avoid it. But in the first example I mentioned, that's actually very healthy, and it can definitely be part of your diet. Number three, which many diabetics avoid, let me explain this to you. I know you might get a little confused, but it's actually pretty easy to understand, and that's milk. Milk is also allowed for those who have, if you are managing diabetes, dairy products like cheese and yogurt are perfectly acceptable additions to your daily diet too. I just strongly recommend that you try to opt for options like skim milk and other low fat dairy products, specifically since the excess fat has been removed. That way, you can balance your overall meals much better, and you will be able to add them into your routine more easily. Does that sound okay to you? Oh, but I heard in the video, I said I was going to talk about the controversy around milk, that when I drink milk, my body breaks down the lactose and my blood sugar levels go up. There's a glucose molecule, actually. That's a fact. The answer is yes, it's true. That's gonna happen, and it's natural for your body to digest milk. That's what we expect, that's what we want, but it's not gonna be a glass of milk, for example. So, half a glass of milk or a slice of cheese, that's gonna throw everything out of balance. So, milk can also be part of a healthy diet for people with diabetes, especially because when you choose skim milk, you have a drink that's low in calories, has an interesting amount of protein, for example. And yes, milk protein is very good. So you're able to get nutrition. It's also a source of calcium and it doesn't cause a spike in blood sugar levels. So, milk and dairy products are, in fact, extremely necessary and good for your health. There are even studies showing that milk has anti inflammatory potential, contrary to what many fake doctors say here on the internet, okay? So, what's the issue with this? As well, if you're lactose intolerant or allergic to milk protein, then you do need to avoid it, okay? I'm not questioning that. If you drink milk, you have various allergies in your body, or if you drink it and feel sick, start vomiting, or have to run to the bathroom, then it's worth avoiding milk, okay? But that's a personal matter. Most people don't have any problems digesting milk, deal? So you can drink your milk without any worries. If you like yogurt, I really like yogurt. In the afternoon, I even add a little chia to it. This combination is excellent for people with diabetes. Number four, that diabetics avoid, but which are also excellent foods, are vegetables like cruciferous ones, for example. Broccoli, cauliflower, Brussels sprouts. Why do many diabetics avoid them? Because there's this rumor, this myth on the internet that broccoli or cauliflower can harm your thyroid and throw everything off. So, your blood sugar levels, this is a big myth. It's not an agrohydrogenic substance, as many people call it. This hasn't been proven in humans. So, if you like these vegetables, you can eat them as much as you want. So, what's the issue here? A lot of people say that broccoli can harm the thyroid based on a study in rats, where the rats were fed only cruciferous vegetables, broccoli and cauliflower. Rats that ate a lot of this developed an enlarged thyroid, which we call a goiter. The thyroid starts to grow, and some developed hormonal changes. But this hasn't been seen in humans. In other words, it doesn't happen to people, so there's no need to worry about it. You also don't need to avoid it. I eat broccoli almost every day. If you like it, it can definitely be part of a healthy diet, even for people with diabetes. Continuing with our list, there are still 3 foods left. If you're enjoying this, I invite you to subscribe to the channel and turn on the notification bell. If you're already subscribed, don't forget to hit the like button. Let's keep going with our list here. And number 5 is another excellent combination. I'm going to talk about drinks. There are 2 drinks here that have a very interesting antioxidant and anti-inflammatory potential that I want to highlight. The first drink is coffee. The second is green tea. A lot of people have asked, I like coffee, is there an alternative? Yes, you can have green tea, for example. If you don't like green tea, you can have coffee. These drinks are studied for their effects on the body. Coffee, for example, contains tocopherol, which is vitamin E, as well as polyphenols and other substances that can help your body and your metabolism. But coffee by itself, I've heard that it's not going to work miracles, it's not going to cure diabetes, and of course not, otherwise it would be too easy. Just drink coffee and no one would have diabetes anymore. The answer isn't that simple. It's a set of actions you need to take to see improvement. And having a little black coffee, for example, is one of the measures that can help with this control. There was even a study that looked at people who drink coffee, 3 to 4 cups, not more than that, because coffee can also have adverse effects on the heart, for example. Doses higher than 8 have already been linked to an increased risk of arrhythmias. So the recommended amount would be 3 to 4 cups. But the people who consumed the amount I mentioned had a lower chance of developing type 2 diabetes. That was what the study observed, okay? So that's already a significant finding. If you like drinking coffee, okay, and green tea as well. There aren't as many studies, but based on the effects we know, it can also help you. If you like it, it's worth it. Now, if you don't like either drink, you don't have to drink them, no worries. Because there are other alternatives that I'll mention here. All right? It's worth noting that the dose of 3 to 4 cups, if it's espresso, then you convert that to 3 or 4 shots. Otherwise, it's 3 to 4 medium cups of coffee. Oh, and the coffee should be without sugar, okay? Don't add sugar, especially if you're diabetic, because then it can actually make your blood sugar levels worse. How do you take your coffee? I like to drink it without sugar. I drink espresso. There's a brand of espresso coffee I really like. I drink it every day. And if you really like your coffee sweetened, you can use a sweetener, for example. A natural sweetener like stevia also won't harm you. It doesn't raise your insulin. It's very safe and you can add it. It can be part of a healthy diet, and if you want to do like I do, you can cut back a little. If you use a little sugar, next week use half, then half of that. And that way, gradually, you get used to drinking coffee and you won't be able to drink sweetened coffee anymore. I'm proof of that. And I want to invite you to comment if this has happened to you. How do you drink your coffee? How do you prepare it? Also, leave a comment here and tell me which city you're from so I can see how people in your city are used to drinking coffee. Let's move on to number 6, and this one's also really interesting. And this item here has been the victim of a lot of misinformation on the internet, which is fish, like sardines and salmon. Fish are a source of protein, and these fattier fish, which are rich in omega 3, can help your heart, for example. They're excellent for people with diabetes. You know that people with diabetes need to take care of their heart. One of the main concerns is exactly that: heart attacks, also known as myocardial infarctions or strokes. And fish can help with that, helping to improve the fats in your blood. So, why are so many people with diabetes avoiding them? These fish, because there's a rumor going around on the internet that these fish are contaminated with mercury, and that mercury would harm your health. There are some very particular and specific cases of environmental contamination, mainly involving certain types of fish that are positioned significantly higher up within the aquatic food chain, like tuna, for example, which is a very common and well known instance of this issue. Or, for example, dogfish, which is a type of shark, or swordfish. But there are only a few types of fish you really need to be careful about when it comes to mercury, especially if you're pregnant or if you're a child, for example, or if you're giving it to your child. So, fish like sardines and salmon are safe to eat, except in cases of specific contamination. But you have to look at each case individually. It's specific to each situation, and it's not generally recommended to avoid these fish. On the contrary, eating sardines, for example, is actually good for your health. If you don't have access to these fish, a lot of people say, oh, in my region where I live, this fish is really expensive. It's really expensive to eat sardines, it's really expensive to eat salmon. You can eat whatever fish you have access to. Why? Even if it's not a source of omega 3, that fish will still give you a good amount of protein, which people with diabetes need to maintain muscle mass and keep their metabolism healthy. A healthy metabolism needs a minimum amount of protein. And number seven, another food that people with diabetes tend to avoid but really shouldn't is eggs. Eggs are excellent for people with diabetes. And here I'm talking about eggs with both the white and the yolk, what we call whole eggs. Because in the egg white, you have about 6 grams of protein per egg. That's a really good, very significant amount for people with diabetes. And in the yolk, we have vitamins and healthy fats like B complex vitamins, vitamins that help your brain and your vision. So it's worth it to eat the egg with both the yolk and the white. For people who eat a lot of eggs per day, like those who go to the gym, for example, 15 eggs a day, then yes, you'll need to remove some of the yolks to avoid having too much fat. But for those who eat a normal amount, me for example, 1 or 2 eggs a day, you can definitely eat the whole egg and it will benefit your health. If you're diabetic, then it's even better. From 0 to 10, what score would you give this video? If it's a 10, I'll make more videos like this one. Now, I'm going to leave a suggestion for you to watch. It's a video where I talked about vegetables, salads. Just like broccoli and cauliflower can help you, there are some vegetables you should pay more attention to because they have more starch. And that's when, yes, diabetics need to be careful. You need to be extra cautious. You want to know which vegetables these are? If you click here, you'll be taken to a specific video where I talked about this. And I made a ranking of the best and worst vegetables. Take care. See you next time.